Hello, everyone. My name is John Tahito. I'm the physician leading the Research and Academics Committee for EMS, and I'd like to give an update for the accomplishments we've had for the last 6 months. So the objectives of this presentation will be to first talk about the published work that we've had during the past 6 months. Um, Keep in mind that anything that is published as emergency medicine specialists as an affiliation listed on that publication, and so that will certainly help to kind of spread the name emergency medicine specialists, um, really nationwide and worldwide, so people can see some of the research that we're doing. I'm also going to present some manuscript reviews we've done during the past 6 months because some folks in the group have helped quite a bit with the we also critically appraise manuscripts that are being um, considered by scholarly journals, and then we present to those journals our recommendations, edits, and if the manuscript should or should not be published. I'm then going to talk about the manuscripts that we have that are still being considered by scholarly journals and present some upcoming projects. In the Canadian Journal of Emergency Medicine, this a case report of thunderclap headache, pearls and pitfalls, was published. This is a excellent case of reversible cerebral vasoconstriction syndrome um, in a patient, and Dr. Fine, as well as Joseph Honrath, who is a medical student, were involved in publishing this manuscript. This was a manuscript review we did for the Journal of Emergency Medicine. It's a study that looks at age-adjusted shock index for use among pediatric patients to determine to be used as a predictor for hospital admission. And so David Fine, as well as Matthew Treat, helped review and critically appraise this manuscript for the Journal of Emergency Medicine. This is another manuscript, also for the Journal of Emergency Medicine, which is titled A Rare Case of Headache in the Emergency Department, a case report which we critically appraised, and it turned out that this patient ultimately had an intracranial dermoid cyst, rare congenital tumor that was getting larger and ultimately led to this patient having a herniation and requiring acute surgical management. And so this was another critical appraisal for the Journal of Emergency Medicine. This is a survey study that the survey and data collection was originally done by several physicians and other folks in the EMBC um, organization, and they asked me to write it up and see if we can publish it. Survey studies can be particularly difficult to publish because they inherently have a lot of bias. However, thankfully, we actually were able to get it published in the National Journal of Emergency Medicine. You can see among the authors, Dr. Maurer, Lisa Maurer, was involved in publishing this. And it is basically a survey that looks at physician caliber, physician hospital and community involvement, and comparing factors like that, other emergency department quality measures among democratic emergency medicine practice groups, physician-led democratic emergency medicine practice groups, and an all-comer kind of survey um, performance report. That was a nationwide performance report. So we got this one published this year as well. This was a case report that Becca, Matthew Treat, and Dr. Fine worked with me, and we were able to publish it. A really interesting case at Franklin of pituitary apoplexy in a 29-year-old male. He ultimately came in with a seizure, altered mental status, severe hyponatremia that was due to um, SIADH, and pituitary apoplexy, which was an enlarging pituitary tumor that hemorrhaged and led to mass effect and herniation. He also required acute surgical management and had a very good outcome. This is a case series that Matthew Treat worked on with me. The Greater Palatine Foramen um, greater palatine nerve block is an injection at the greater palatine foramen, which is essentially just at the very posterior aspect of the hard palate in the mouth. This is a block that we sometimes do for purposes of kind of dental anesthesia prior to some sort of basic dental procedure. However, the uh, um, greater palatine artery actually um, goes through that foramen, and therefore injecting the area with lidocaine with epinephrine has been suggested and studied in the ENT literature to help decrease blood flow to the nasal septum. Um, and so then it has been described once in a European journal as a potential for epistaxis treatment. And therefore, we did a case series on this and published it, and it was accepted for publication in the American Journal of Emergency Medicine. And so far, we also have a few big studies that are being considered by scholarly journals. These do tend to take a little bit longer because these aren't just case reports; they're actually some of the chart review research that we've done, and it can be sometimes somewhat difficult to get them published because there's a more robust review process. But a retrospective analysis of tranexamic acid use in acute undifferentiated angioedema. This study, Matthew Treat worked with me on it, Beth Adams as well. We also had a medical student from the Medical College of Wisconsin helping us out that was introduced to me by Dr. Peterson, Austin Tubbs, and so these are all authors on this manuscript, so that's being considered in the Internal Medicine Journal right now. Another study we did, a retrospective analysis of dialysis patients presented to the emergency department with bleeding arteriovenous fistulas or grafts. Myself, I believe Matthew Treat was involved on this, as well as Heidi Toth. This one is also still being considered in scholarly journals for publication, so just keep your eyes open at the upcoming newsletters for when we can finally get these published. And right now we have a few ongoing projects. We are looking at the utility of the stool occult blood test or the guaiac test as a marker for GI bleeds that are clinically important in the emergency department. And we define clinically important as, and based on a prior publication, there's actually a standardized definition, but it is essentially, did this GI bleed require a procedure with an intervention? It wasn't just a endoscopy and they saw some gastritis and nothing else, and so nothing was done. Because the guaiac test really was originally developed for colon cancer screening. And so there is a lot of argument and question about using it as a diagnostic tool or really diagnostic aid for clinically important GI bleeds or GI bleeds in general. I won't go into further detail, but we are doing a retrospective study on that, and it is currently submitted to and being considered by the Ascension IRB. Dr. Benson also submitted several very interesting cases. She seems to have a lot of really interesting cases that she comes across, and I would like to start looking into publishing those. I've been a little slowed down because my wife and I had a baby a few months ago, but I'm starting to pick things up, back up again. And she has a really interesting case of a high pressure injection injury into a finger that required multiple INDs with some really educational images. I've also gotten some other interesting cases from Matthew Treat as well as Trent for consideration that I'd like to start working on once we get the stool occult blood test study up and running. I've also had interest from two other residents to be involved in the stool occult blood test. Dr. Makowski has connected them with me, so it's good to get a variety of folks, from different specialties. We even have a pharmacist, Jeff, involved on one of our the TXA study um, to really create a collaborative environment for research and academics that I think is really useful and really um, kind of helps um, show our reputation as being collaborative and wanting to work together to kind of learn and ask these clinical questions and provide them as good research topics. So hopefully this gives you a good overview. I apologize I cannot make it to the meeting as I'll be out of town, but thank you very much for your time.